Hi, welcome to another one of our Dr. Foot videos. This video is another video on the series of videos I'm doing reflecting on spending time with other health professionals as part of my MSc in Sports and Exercise Medicine. So, as I've said before, I'm having to spend time with doctors, osteopaths, physios, as well as fellow podiatrists and radiologists actually. So I'm really enjoying it. I'm learning so much, which is great because I love learning from other health professionals, and I'm not arrogant to think that I know it all. So there's a lot of people that can teach me a lot of different things. So last week I spent 2 days with two awesome podiatrists, and I want to reflect a little bit about this. The first chap I spent some time with was a guy named Griffith. Ian is, apart from being a brilliant podiatrist and really knows his stuff, he's based in central London. So if you have any discomfort, any MSK issues, go and see him. What I really took away from Ian was the way he spoke to patients. Now, he would not only treat the patient's condition, he would also treat the patient themselves. So he would address their fears, anxieties and beliefs, why they fear that they may cause further damage if they do a certain movement. And he would go through an entire consultation, which is an hour long, and he wouldn't use the word pain, and he wouldn't use other words that would reinforce a negative emotion, which I found fascinating. And he would do this purposely. He would still treat the patient and he would still give brilliant treatment and advice, but he was very careful in the way he phrased certain sentences, and he would give patients examples that they could relate to rather than medical jargon, which I found fascinating. So he would give them real life analogies that the patient could relate to and could understand why they have a certain type of health condition. It's brilliant, absolutely brilliant. So I learned that from him, and that's what I really took away from him. The second podiatrist I spent some time with was a chap named Trevor Pryor. Now, Trevor Pryor taught me biomechanics in 1993 at the University of Westminster. So you can imagine how long he's been around for. He is a podiatric surgeon. A lot of people came to him for a surgical opinion, which I found fascinating. He's also a great advocate of 3D gait assessment. So I saw quite a few 3D gait assessments. Now, those podiatrists and those patients that know me know I love my gadgets. I love my podiatry gadgets. Now, 3D gait assessment is like your Star Wars type of gadget. Just finish off my coffee. It analyzes everything. So it analyzes all your movements while running. I definitely want to get one in the next 12 months. I'm going to need a bigger clinic to get one. But I definitely I do want to invest in this. Now, it does analyze, as I said, it analyzes all the muscles, all the movements, and it gives you a breakdown of which area of the body is compensating or is not strong enough, and that may be the underlying cause of a particular type of condition. I found this really, really fascinating. He also does in-shoe pressure analysis. So they have sensors that go inside shoes, and then the patient walks, and you can see exactly what bone or area that patient is putting excessive stress on while they're walking in their shoes, which is brilliant, really, really fascinating. I learned so much from Trevor Pryor as well as Ian Griffith. Now, I'm finding these shadowing sessions hard work. First of all, I'm having to take a whole day out of clinic and go to mainly to London to spend some time with these health professionals. However, I am learning so much, and I'm finding it an invaluable resource, because all of these different health professionals have said to me, and it really sticks in your head, and you can apply it to patients that you see, and it gives you a different perspective, not only on how to treat patients, but as I spent time with Ian Griffiths, is how to speak to patients, which I think is also very important. Anyway, I hope you enjoyed this video. I better get back to treating patients. Actually, I've got a good half an hour, which is a long time for me to have off. I will speak to you soon. Take care.